My name is Alyssa Brown, and I'm an American Heart Association volunteer. I also am a parent of a daughter that has 4 congenital heart defects. She's cute. I brought her photo. And we're here today to demonstrate pulse oximetry. It's a safe, quick, and non-invasive way to detect congenital heart defects, and it can help to save the lives of Florida children. Pulse oximetry screenings are easy, inexpensive, and painless. They're a way to ensure that babies go home from the hospital safe. And current screening methods, which include ultrasound and physical examination, pick up less than half of the occurrences of critical congenital heart defects. Without a pulse oximetry screening, a child is between 4 and 5.5 times more likely to go home, presumably healthy, but with an undetected defect. Undetected heart defects can lead, at best, to avoidable health complications and expenses, and at worst, to death. Pulse oximetry screening could help to detect an additional 30% of critical congenital heart defects cases. And so that's why we're here today, and we've invited you to demonstrate for you how easy this is. You've got more information in your packets, and you will be able to access those after the demonstration, and we're happy to answer any questions that you have. We also have 2 adorable volunteers here, Miss Ava and little Mr. Jason, who have graciously been volunteered by their parents. So thanks so much to the parents. And so we'll go ahead and get started.
And what we do is we just apply the O2 sat onto the right wrist. And it's going to take a few minutes before it starts reading, which was a lot quicker than for her. So it's 100% oxygen on her right wrist. And then we go ahead and do a reading on either foot.
I know, I'm sorry. That's it. Should pick up because she's not moving too much. Usually they're fighting us.
And she's 100%. So basically what we do is we look at and measure a difference between the right wrist and either foot. And if it's like greater than, less than, or equal to 3% difference on either reading, we repeat the test in an hour. And then if we get a same difference again, we repeat it another hour later. And if we get 3 tests that have a difference in it, then we call the physician, and they usually get a referral to a cardiologist.
Echocardiogram. That's it.
This became available back many years ago. In 2003 was the first article in the journal Pediatrics, and I went to the staff at Tallahassee Memorial, and so ever since 2003 we've screened every child who was born at TMH, and we no longer have kids coming in who have died or almost died as a result of severe congenital heart disease. So it's easy to detect, but not all places do it, and the purpose of the legislation is to have all places do it. The CDC is now recommending that for all nurseries, and it's so simple, it's so inexpensive, and it just makes great sense to go ahead and do this. I think that the only cost is going to be the administrative cost for Children's Medical Services within the Department of Health, who will have to administer this program. As far as the cost to the patient, it's minimal. It's just a few pennies for a pulse ox test. Pulse ox meters are everywhere. You go to the emergency room, you go to the nursery, you go any place in the hospital, you go to a doctor's office, they're everywhere. And they're very simple to use, they're very accurate, and it's just a matter of applying the technique at the appropriate time.
You know, if it's so simple and cheap, it's kind of hard to understand why a hospital wouldn't do it as a matter of course.
I think that it is an item that's just come to light as a great way to detect this undetectable problem, and I think that screening and prevention are really the way you have to go for most things, and I don't think that's been popular up until recently.
What happened to the legislation last year?
It had a fiscal note which was unfortunate and not correct, and because really it's very inexpensive. It will cost the Department of Health some funds to administer the program, but in terms of driving up insurance costs and whatever, that's crazy. It's not really going to do that.
What's the cost if a baby has to come back to a hospital? I mean, what's the cost?
Thousands of dollars, and you know, if the baby dies, what's the cost to that family? And if the baby's brain damaged, what's the cost to that family and to society? It's so simple, it's crazy not to do it.
Are there any lawmakers that you guys are already planning to partner with on this?
I don't know who's filing that this year, do you know?
Senator Jeremy Ring, and I don't know if there's a House.
We're still working on a House sponsor at this time.
Senator Ring filed the bill last year.
Okay, hearing no more
Anyway,
questions.
I'm
then-
glad the Heart Association is doing this. I think it's terrific, and I'm with the Florida chapter of the American Academy of Pediatrics, and we're totally supportive of this effort as well, and it's part of our legislative agenda.
Thank you, and thank all of you.